And joining us now is a genuine outsider, British cardiologist Dr. Aseem Malhotra. Dr. Malhotra is a relentless public health campaigner and truth seeker, known for speaking out and fighting against big pharma, even if it rubs people up the wrong way. Dr. Malhotra believes the COVID vaccine has been a contributory factor to 30,000 excess deaths from heart disease in the UK. That controversial view is challenged by the mainstream medical community. I'm pleased to say, not only is he out here in Australia, but Dr. Aseem Malhotra is here in the studio with us now. Aseem, great to see you. You had a big sellout performance or event last night in Sydney. You're going on to Canberra, Brisbane, Melbourne, so lots of people can hear you and listen to what you have to say. But let's kick off. So I mentioned the 30,000 excess deaths. We'll get onto that in a second. But tell us, you are a cardiologist. I know you had the tragedy of your father's death. So tell us about that.
Yeah, thanks, Rowan. I think the first thing to say, in terms of the broad overview, what we're dealing with here, they say that in a time of universal deceit, telling the truth is a revolutionary act. And what we're dealing with here, without a shadow of a doubt in my view, is probably the greatest medical deception we will witness in our lifetime. And that is specifically in relation to the narrative that has been pushed on the COVID vaccines. Now, just take a step back for a second, Rowan. One of the things we learn in medical school is 50% of what you are taught in medical school will turn out to be either outdated or dead wrong within 5 years of your graduation. The trouble is nobody can tell you which half, so you have to learn on your own. And I think we can apply that concept, certainly in my evolution, in understanding the situation with the COVID vaccine. So I was one of the first to have 2 doses of the Pfizer vaccine in January 2021. I went on Good Morning Britain in February to help tackle vaccine hesitancy when at that stage we were only offering it to high-risk people and the elderly. But the evidence changed very quickly. What became apparent within a few months, which is well known now and established, it wasn't stopping infection, it wasn't stopping transmission, even if it was preventing serious disease and death, and I'll come on to that in a second. And then for me, one of the initial triggers to investigate this further, unfortunately, was my father, who was vice president of the British Medical Association, suffered sudden cardiac death in the summer of 2021. He's a very fit guy. His post-mortem findings didn't make sense. He had very severe coronary artery disease, even though I knew his heart health was pretty good, and he was a very fit guy. And then lots of evidence started to come in, which made it very clear that there was a signal of harm. At that time, I think this is relevant to Australia as well, when we had evidence of signal of harm and it wasn't stopping transmission, our Secretary of State for Health, Sajid Javid at the time, said that we need to mandate this vaccine for healthcare workers. Now, we've never done something like that in the UK, and I then lobbied through the mainstream media, BBC, Sky News over there, and indirectly getting contact with Sajid Javid through the chair of the BMA to say this was unethical, unscientific, and ultimately we helped. I was one of the campaigners to overturn that. I find it quite extraordinary that in Australia, not only did you do the same sort of mandates, but doctors and nurses lost their jobs if they didn't get the vaccine. And this is, now there's a grassroots movement over here called AMPS, Australian Medical Professional Society, doing great work to try and fight back against this. And given that evidence, I'm going to come on to the most crucial bit in a second. For me, I think it's high time that APRA and the medical boards over here acknowledge the evidence changed, apologise to those healthcare workers and everybody else that lost their jobs, and get them compensated. That absolutely needs to happen. But in evidence-based medicine, that's what I'm an advocate for. Medical ethics, informed consent, improving my patient outcomes. Just looking at the quality of evidence on the harms and benefits of the vaccine. A re-analysis was done by some of the world's most eminent scientists when it comes to integrity. Peter Doshi, associated with BMJ, Robert Kaplan from Stanford, Santa Greenland is probably considered the top epidemiologist in the world. They were able to reanalyze Pfizer and Moderna's original trials, Rowan, that led to approval, coercion, and mandates of this COVID vaccine. And what did they find? They found that from the very beginning, you were more likely to suffer serious harm, disability, life-changing events, hospitalization, than you were to be hospitalized with COVID. What does that mean, Rowan? When I look at that as a doctor, public health campaigner who understands evidence-based medicine, not a DTI campaign on this issue, it means it's most likely that this COVID vaccine should not have been approved for a single human in the first place. It's that bad. This is what we're dealing with now.
Okay, so at that point I've got to step in and say that the TGA, the Therapeutic Goods Administration here in Australia, disagree totally with you, and their claim, or they state that the vaccines are the best way to prevent death and serious disease from COVID. So I'll just say that. You have a lot of critics in Britain. Professor Mark Dweck, Chair of Clinical Cardiology at the University of Edinburgh, has said of you that I think that Dr. Malhotra's opinions on both statins and COVID vaccines are misguided and in fact dangerous. So they're saying your opinions are dangerous. They're saying that the vast majority of cardiologists do not agree with your views because they are not based on robust science. So there's a big gap between what they're saying and what you're saying. But carry on.
Well, I'm glad you've raised those 2 points. Really glad you've raised it. So let's talk about the TGA. During the summer of 2022, I presented during the BMA annual conference at a fringe event. I gave a presentation, and the people that were present at that event were the chair of the British Medical Association and the president of the British Medical Association. The chair was gobsmacked because I just presented new evidence that had come in the BMJ, done by actually one of your most prolific, brilliant investigative journalists, probably in the world, Marion Damasi, Australian, that revealed that most of the regulators around the world, he was shocked, the chair of the BMA didn't know this, were taking their money from industry. So what does that mean? The FDA getting 65% of their money from pharmaceutical industry. The MHRA in the UK getting 86% of its funding from the pharmaceutical industry. But guess which regulator topped the lot? The TGA. 96% of funding of the TGA comes from the pharmaceutical industry. Now, why is that important?
Okay, well, again, I've got to stop you there because I don't know if that is true or not.
It is absolutely true, but it's true, though, and you can look that up.
Okay,
but on that,
put that to one side.
But that means, and Donald Light, sociologist in the BMJ said, and I agree with him, that the public and doctors and even media and journalists must understand that as long as regulators take money from industry, and we're talking about industries here, multinational corporations whose only motive, legal obligation is to produce profit for their shareholders, and often, according to forensic psychologist Robert Hare, in their pursuit of profit, as entities, not individuals, they behave like psychopaths. Incapacity to experience guilt, deceitfulness, conning others for profit. So we have to understand who's really calling the shots here, Rowan. If we go to
but that is a huge assertion. So yeah, Rita.
Well, there can be very grim consequences for pharmaceutical companies if there are adverse reactions for individuals and if individuals have been misled about the safety of a product. In this instance, though, there's some immunity provided to those companies. So take us through that and what that has done to how things are normally...
Rita, it's a really good point you raise, and quite shocking for most people because even I wasn't fully aware, and I consider myself someone who's a public health campaigner, who's looking at evidence, looking at manipulations and excesses of pharma. And it was only much later on that I was told, when I researched it, because it wasn't mainstream news, it wasn't discussed in detail at the beginning, that drug companies, at the very beginning, who were manufacturing these vaccines, got immunity from governments across the world. If vaccine injuries were to occur, they could not be sued. Now, for me, and I've spoken to somebody, by the way, somebody who's quite senior, a corporate lawyer, who actually contacted me, very senior, involved in this, who didn't take the vaccine. For him, in all his work, he said to me, Dr. Malhotra, for me, that was a clear red flag that something fishy was going on, and that was enough for him not to take it.
But you could say that occurred because, we had a worldwide pandemic, we had these crippling lockdowns, and we needed a vaccine to be developed in record time. So to provide that immunity, you can see why it was for the greater good, perhaps.
Well, absolutely, Rita, but the fact is, if that was the case, they cannot then say, we know that this vaccine is completely safe and effective. Right? Because that means that the drug companies knew there may be a problem. And in fact, what this re-analysis showed in the journal, published in the journal Vaccine, by the way, where they showed greater harm, that showed a rate of serious adverse effects from the highest quality level of evidence of at least 1 in 800. Probably much higher for lots of other reasons. But why that's important is the public and doctors, and that's why I also was brought into the narrative, have always believed that vaccines have a special place in medicine. They are safe and effective. The rate of serious adverse events from other vaccines